I don't have to tell you the healthcare system in this country is in critical condition. The cost of medical care is soaring. The number of uninsured Americans is nearing the 50 million mark. How do we provide access to affordable health care? That's the question for lawmakers in Washington and our very important topic tonight on Voice of Reason. Hello, everyone. I'm Larry Kane. There is a health care crisis that's so bad it's probably going to get worse before it gets better. Almost everybody watching knows there's a problem. And now President Obama and the Congress are trying to figure out how to fix it. That's where it gets complicated. There's so many different opinions of where the problems are and how to solve them. And that's why we're talking to three fantastic experts tonight on Voice of Reason to try to bring some clarity to all of you. Starting off with Mark Pauly from the prestigious Wharton School of Business, University of Pennsylvania, professor of healthcare management. Dr. Theodore Christopher is also joining us. He's the chairman of the Department of Emergency Medicine at Thomas Jefferson University Hospital and a professor at Jefferson Medical College in Philadelphia, immediate past president of the Philadelphia County Medical Society. And rounding out our panel is Dr. Gerstman. He's a practicing physician with Concierge Medical Services of Family Practice Associates of Upper Dublin, also assistant medical director of Life Laboratory Incorporated in Fort Washington, a nonprofit research organization, member of the faculty at Abington Family Medicine Residency. Well, Mr. Pauly, you have advised the Bush administration. You are advising the Office of Management and the Budget. I believe the U.S. Congress, the oversight. What is going to happen as we develop, as summer months progress in the fall? Where do you realistically think this is going to go? And then we'll do some interpretation of what that means.
I think realistically, something will happen and be declared to be health reform or a first step in the direction of health reform. My own expectation is that that there will be some relatively modest steps taken to try to provide greater subsidies to reduce the number of uninsured people. And a number of things will be put in place on the promise that they'll help to control the rate of growth of spending. Now,
these doctors here all have, their own reason for understanding this crisis, but you're a student on it, and you're probably, according to my information, one of the finest scholars in America on our problem. What is going to happen if a person's insured out there? If a person's uninsured, what may happen to them in the next year or two?
I think if you're insured, probably not much. In a way, the president has promised that whatever, if you like what you have, it's not going to change. And particularly if you're getting your insurance through a job at a large firm, that's not where the problem is. The main problems arise in small firms, which are increasingly unable to provide coverage to their workers. And there, you may have a new option, something called a health exchange that may give you a way to get health insurance if your employer either can't arrange it or isn't willing to arrange it.
That's a co-op.
The exchange itself is more like a stock exchange. It's more like a marketplace. One of the debated issues, as you know, is of the plans in the exchange. The general idea would be all the private plans that are available in your market that are decent anyway. You could get them in the exchange, but the debated issue is whether there should be, in addition, added a plan that's either run by the government or, in a way, certified by the government as an additional choice for people.
Dr. Christopher, everybody talks about the single-payer system. So I'm at a group recently and said, what is the single-payer system? People think that it's everybody pays the same amount and gets the same coverage. Not correct, right?
Not correct. I think the connotation of single-payer system is that it's a government-run system, and it's really not quite clear exactly what that would look like. For the most part, most doctors in America are not for the single-payer system because they're worried about what that might look like in the future.
What does single-payer mean? In other words, the government just pays your bills?
The government would come up with a plan that actually would pay your bills. But again, it's not quite clear exactly what that would look like. But the catch term is that the government would be involved in that kind of care.
So it's a public health plan that you'd pay part of, like a copay, or how would that work?
I have to defer to my colleague here. I'm not sure how that would work.
How would a single-payer system
Well, I think
work?
the essence of it is, as you said, it would be a plan run by the government and it'd be the only game in town. The closest approximation I think we've had to it is the way Medicare was when it was first passed. There was one Medicare plan. It was uniform for everybody across the country, although Medicare certainly doesn't pay for everything. There are fairly high out-of-pocket payments that people have to make if they can't get some additional insurance. But the general the idea then was that if you're over 65, if you want a subsidized insurance plan, this is it. Over time, of course, the government has added additional private options. So Medicare now isn't single payer anymore.
Dr. Gerstman, your practice in Upper Dublin,
yes,
is very, very connected to new concepts. But before we get into your concepts and what you're not just experimenting with, but doing, your concern is about what you call primary care, which is family medicine, the first place you go to.
That is
not
correct.
the hospital, but the old doctor who used to come with his bag and give you a shot of penicillin back in the 1950s. What is your concern about primary care?
Well, my perspective is clearly that health systems that are anchored in primary care have been shown to provide care at lower costs with better quality. And it's also clear that over the past 10 years, there's been a tremendous attrition of primary care physicians, especially those that are providing care for adults.
They're just vanishing.
They're vanishing, and the reasons for that is medical students have extremely high debt. They're averaging $250,000 of debt when they graduate medical school. The family doctor's income tends to be very much lower, on a lower scale than compared to procedure-oriented specialists. And there's a greater stress with a lot of administrative hassles that they have, that family doctors.
They just don't want to go through it. They don't want to deal with the referrals. They want to deal with all the paperwork.
Plus, they already come out with a mortgage, and they don't have an adequate salary to pay that off and provide a living for themselves.
Let me ask you this question. Do you think that the primary care, the vanishing of the primary care doctor is a very serious problem, and how does the government address something? What about the concept, by the way? I'm just curious about all three of you, quickly, of putting everything in one big computer system and saving all that computer, that paperwork that goes on, all the prescriptions. How about computers? Would that help?
I think it'll help. I don't think it'll save money, because almost nothing saves money. I think it probably will improve the quality of care for a lot of people. There are downsides, or challenges anyway. The data in the computer is only as good to the patient as the ability of the physician who's interpreting the data's judgment is.
You agree with that?
Well, I agree. I do agree with that, but Barack Obama is on record of saying we need to identify what works and what doesn't and deliver it. So we need to, in some fashion, be able to test on a local level how the computers actually work. Do they help? And then bring that out on a more national level. So I don't think that unveiling a computer system because someone said this is what we should do and just roll it out, I think the conundrum is going to fall on its face.
I have a mystery that I want uncovered, and I know the three of you can unravel this. You go into an emergency room, you're taking somebody to an emergency room, and a person arrives without insurance coverage, and of course they're taken care of by the emergency room. They get the coverage, but they might be on public assistance. If anybody is on public assistance, there's no excuse for them not to have care because they're provided Medicaid, right? So who are these people who are going into emergency rooms? Are they making too much money? Or is that the issue?
Yeah, I think that's a myth. I think a lot of people, we certainly see our fair share of uninsured patients in the emergency departments in the country, I think, but it's a myth. I think a lot of patients have insurance who still use the emergency departments. They have private doctors as well. And the reasons why they use the emergency departments nowadays are really myriad. One, access to medical care is a huge issue. I think you'll hear time and time again, I've called my doctor, I called the office, I couldn't get to see my primary care physician.
So they go right away.
It's more convenient for me to come to the emergency room to get my care. Another thing we hear is technology. Very often we hear, well, what's my private doctor going to do from in the office? I'm coming to the emergency room because I know they will send me there anyways. I need a CAT scan, I need some blood tests, I need an MRI. It's much more convenient to have that one-stop shopping.
Mark, I'm going to start calling you by your first names here if you don't mind.
Fine.
Sure. Mark, what is the political impact right now in Washington? The Republicans are saying from what I'm gathering and the sources I have in Capitol Hill, that they do not like the single-payer system, but they